Hi, my name's Thomas Foreman, and in this video I'll be showing you how I examine an ankle joint. This is Libby, she's my patient for today. Do you mind if I examine your ankle?
No, it's fine.
So first of all, we'll start just by looking and seeing if Libby's comfortable, any pain in your ankles at all.
No.
And first I'll get her to walk just to check her gait. So if you could walk to the wall for me, and back. And as you can see, she's got a normal gait. We'll be looking for any limp in there, antalgic gait, maybe signs of pain. Right, next, if you can sit up on the bed for me. We'll have a closer look at her ankles here. Looking for any swelling, any scars, any bruising. And if you come back off for me, that's fine. Right, first of all, can I ask you to do a squat for me? And sometimes that gives pain on impingement. Is there any impingement there? No, any pain? That's fine. If you could stand on one leg for me like this. That's fine. Any pain there?
No.
No. Can you go up on your tiptoes? And onto your heels? Onto the insides of your feet? Onto the outsides.
No.
Any pain? No, that's fine. So all that was normal on examination. So if I can ask Libby to sit back up on the bed for me, and we'll take a closer look at her ankle here. So in this video I'll examine her left ankle. So again, having another closer look, there's no signs of any swelling or bruising, and there's no. Have you ever had an operation on your ankle at all? No signs of any scars, which is good. So I always start my palpation on the lateral side, starting with the lateral malleolus here. So we'll start by palpating around there. Any pain? Let me know if you do have any pain. If it's all normal there. Then I move down to the fifth metatarsal. This is another common injury site for athletes. You can get fractures of the fifth metatarsal. Any pain when I press that?
No.
And then just because I'm here, I'll check all the other metatarsal bones as well. Nothing?
No.
Normally if they were injured you'd see signs of bruising, swelling, and it would be painful to palpate as well. The first MTP joint is another common site of injury. So if you could wiggle your big toe up and down for me. Is there any pain if I move your big toe up? No. Fine. Next we can check the ATFL ligament, which sits just here. We can press. It's another common injury site. Any pain there?
No.
And we can check the syndesmosis here as well, where we just do a squeeze test on the ankle. Let me know if it's painful.
No, it's fine.
And you can squeeze the tibia and fibula further up on the leg as well if you need to. Now when I plantar flex and dorsiflex the foot, you can feel for the talar dome. Is there any pain when I press it? No. Moving more medially now, obviously it'll be difficult to see on the video, but we check the medial malleolus, which sits just on the inside of the foot here. Again, looking for any signs of swelling or bruising there. Down to the deltoid ligament, which is another common injury site there. Okay, when I press on there. And then the navicular bone. So you normally feel the navicular tuberosity, sits about here on Libby's foot. You can press more anteriorly there. Any pain?
No.
No? Fine. Next we'll check the movements of the foot and the strength in Libby's ankle. So if you can push against my hand, there we're checking dorsiflexion, which is normal for her, and if you can press against my hand, that's fine. Press inwards, checking inversion, and then out, checking eversion. The muscles that push out against my hand there, if you do it again, okay. That's it, that's normal for her. That's very common if you get an ankle sprain there. The ankle stabilizers do eversion of the foot. So if you can sit or lie up on the bed for me. Again, we're just going to check the alignment of the feet here, checking for any discrepancies in length. And actually I just like to freely move the ankle joint here. Make sure there's no crepitus or any pain when I move there.
No,
No.
it's fine.
We can do an anterior draw test here, where we take the foot, put my hand underneath, and you kind of pull up on the heel. Any pain there?
No.
Any laxity there would be an abnormal examination and may suggest that there's ligament damage. I can ask Libby to turn onto her front for me now. Right, so here we're going to check for the Achilles tendon, check if there's any abnormalities there. So if you could bend your legs up for me. First of all, what we can see is the feet are normally aligned next to each other. If there was damage to one Achilles tendon, you may expect one of the feet to lie more like this, a bit to the other side. So we'll let her rest naturally there again. So we can do a calf squeeze, and we'll see the foot plantar flexes. Same on the side. That would suggest that the Achilles tendon is intact. And if you put your feet back down for me, you can have a closer look at the Achilles tendon itself, looking for any swelling or bruising, and may actually see ruptures of the Achilles tendon. It's not a very nice tendon to examine. It can be quite painful when we press on it, so I'll do quite lightly here. I can see Libby's Achilles tendon looks normal. There's no bruising, there's no swelling, and there's no scars sitting around it. Any pain when I press there?
No, nothing.
No, that's fine. Right, if you lie on your back for me now. One last test is the impingement test. For this one we can take the foot up and we can do forced plantar flexion, checking for anterior impingement, and forced dorsiflexion, looking for posterior impingement. Any pain there?
No, nothing.
Okay, if you step back off the bed for me. That will conclude my ankle examination. Thank you very much.